As an obesity expert, I urge you all to say no to motivation. If you understand obesity, you should understand it's a chronic, recurrent, relapsing, serious disease with many implications for health and disease, with increased mortality and morbidity. You should also really understand that fat mass is governed by a neuroendocrine regulatory system which is actively maintaining and preserving fat mass. Both that obesity is a disease where healthcare professionals has responsibility of treatment and the intricate understanding of neuroendocrine regulation of fat mass both disqualify the context of motivation. It is not a question about patients with obesity should be more or less motivated to eat more or less or exercise more. It is instead a question to understand obesity as a disease governed by a neuroendocrine system which actually seeks to regain, preserve, maintain fat mass during weight loss interventions. So if you believe in motivation, I believe that you are misinforming the patient. And if you believe in motivation and pinpoint the importance of a motivation, you are actually directly transferring stigmatization and discrimination on the patient. Because when the patient is regaining weight or not losing weight during obesity intervention, it is not a question about lack of motivation. Instead, it's a question about that obesity is a complex chronic disease with an active neuroendocrine system to regaining and preventing fat mass loss. Thus, it is crucial to important to understand that you can actually totally disqualify motivation, not go into it, not mentioning it, not using it in clinical practice, and thereby treating your patients with more dignity, with more professionalism. Please give up on motivation.